with the mental health funding that they've pledged, which services were they going to be privatising and which services are going to benefit them most from?
Again, we have very clear policies about contributions to not just the NHS but all aspects of social services and mental health issues services as well. One of our key objectives is to help people. It's not just about animals, it's about, the party actually is for animals, people and the environment. So people, we have quite a lot of policies about people. We are concerned about educating. We think that on one level you can treat problems that people have, but on another level to try to prevent those is absolutely key.
The other part of the question is, like, which services would you be privatising? Or?
None. Oh no. We have no privatisation in our manifesto whatsoever. In fact, actually, we have renationalisation within it. And contributing to the public services for everybody. It's about fairness and accessibility for all at every stage of their life. Talking about services, for example, mental health issue services, education we think is fundamental within schools, that there should be equal status given to learning about problems in life and how to think about them, how to develop resilience, how to overcome these problems ourselves, how to understand that we do have problems and that problems are natural. It's not natural to live a fully 100% happy lifestyle all of the time. It doesn't work like that.
No.
And social media puts this pressure on young people so much, and schools put pressure on the people so much to succeed, that there needs to be balance. And so we would seek to have, as part of the education system, putting life skills on an equal level with academic subjects in order to help prevent these issues. It's not just about tackling them once they've happened. So it's about developing the inner resources of the individual.
So you're right, we are increasing mental health funding. This year alone we've increased it by about 537 million to reach about 12.5 billion. And as part of our NHS sort of long-term plan, we're increasing that by another 2.3 billion by 2022. And obviously it's not all about money, it's how you spend it effectively and what you target that at. I want to say there will be no privatisation whatsoever. I think we recognise that I was a health minister for several weeks until I got reappointed as science minister, that the best place to invest our money is in a public NHS because it provides the best value for money. It's able to pool money and investment together, and also it's publicly accountable. And so what we want to do is look at how we can invest using NHS resources for the future, that mental health spend. So some of that will be an increased investment in CAMs as well. So they're going to be pledged that there'll be an extra 380,000 CAMs places for adults and 345,000 CAMs places for young people. We've also want to increase our special educational needs funding. We're increasing that by 12% next year, about 380 million, because it shouldn't be this way, but in government you have different departments. You've got the education department, you've got the healthcare department, but if you have a mental health condition, you're often covering lots of different departments. And so what we need to do is try and join these services up better so the money is better targeted. And one of the things we want to do is look at how we can have mental health support teams in schools, but also in the NHS as well. Frontline, a sort of new form of frontline service that'll be able to effectively recognise conditions before they get worse. Because there is a prevention element there. If you can spot someone's mental health condition early, then you can get them that support that they need before it spirals out of control.
Well, in terms of the NHS, so the Green Party's pledge is an extra £6 billion a year, a significant portion of which is towards mental health. Obviously, mental health funding has been drastically short and cut further by the austerity government over the last decade or so. And with regards to privatisation, the Green Party is completely opposed to all forms of privatisation in the NHS, and we go beyond just not avoiding privatisation, but also undoing the privatisation that's been done sort of the last decade or so under the Tory government?
At the moment I work for the NHS. I'm a mental health specialist, so mental health is something that I'm really concerned about. So we're going to put money in across the whole of the NHS because we've got hospitals that can't meet the demands of people. We've got GP surgeries, and I heard on the news yesterday that some people have to wait a month to be seen, and then and that's not good enough. You know, if you need medical attention, you need it straight away. So we need to think about the whole of the NHS. But what has historically happened in the NHS is that some services, they put more money in than others, and mental health services are often seen as the poor relative, so they don't get very much money. The Labour Party is saying we need to stop that, and we need to treat all services the same. So we will make sure that mental health services are fully resourced, and I feel, and the Labour Party feels this as well, that people should be able to access help in the community rather than it be such a complicated process. I think we need to work more with service users to find out what their needs are and how we make it easier for people to access help and support when they need
The last
it.
couple of years, I mean, I've got letters from that and saying, you know, about services being cut, and they're cutting more and more and
Yeah.
shutting more and more places down.
Yeah.
So to get the help that I wanted now is not around.
No, it's terrible because when services become very scarce, it means that people set priorities, and so you have to be at the top of the priority in order to get help. But that's not the best way to help people. The best way to help people is before they need that top level intervention, before
Yeah, 'cause
that
all I
real
get told
crisis.
is, oh, we'll put you on the waiting list, and then
Yeah, that's not good enough.
the waiting list, they don't say how long it's going to be in that.
And I think mental health services have had their budgets cut so much that they just cannot provide the service that they would want to provide. And I know it's not the fault of the people who work for the NHS because they really want to do their best for people. It's the fault of the people that fund the National Health Service. I think one of the things that we need to do better in mental health is also get service users more involved in helping us shape the way that we deliver services, because we can only guess how people want to benefit from health services. It's only by talking to people and asking, you know, how can we do it better, that we can actually make it better.
What we've said in our manifesto is we would put a penny in the pound on every pound from tax, so that we would raise tax by sort of 1%, and that money would be ring fenced for the wide range of health services, and as you say, 35 million of that would go into one particular area, and we would want to focus most of an appropriate sum of that onto the sort of preventative work, so making sure that mums with their newborn babies are able to access mental health services. We'll want to also make sure that children and adolescents, as they go through that period of their growth, can access services like CAMS, so the children and adolescent mental health services. So we make sure that we could put the appropriate services at the right points in people's lives so that they can access it at that point, because we are very much aware that if you can prevent a health condition either getting worse or becoming much more of an issue for the person, that not only are you making that person's lives better, but in a financial sense as well, you're saving other services, perhaps 4 times as much money later on in life.